So now we're quickly trying to look at some issues that are usually associated with using contrast in imaging. When I image you, I want to now add some one or two materials in your body so that that imaging can be very much more clearer. I can get more details for my studies. So, but those things, they usually have issues, okay? So they're actually serious complications, and they are linked to you using contrast in imaging procedures. It's not only imaging procedures, right? It's the contrast, to be specific, So we have the nephrogenic systemic fibrosis. Okay, this is what we got. So once you say fibrosis, you say different tissues in the body are actually, dying. Okay. So it's a rare, but it's actually a severe disorder. It's characterized by fibrosis of the skin, of the joint, and internal organs. It's associated with exposure to gadolinium-based contrast, and it's used in MRI, especially in patients that have severe kidney dysfunction. So a patient has a bad kidney, so it puts gadolinium. The kidney is supposed to excrete it out. So the kidney is not being able to excrete the gadolinium out. It accumulates in the body and cause a lot of issues, right? So pathophysiology, so gadolinium is deposited in tissues. That's when the kidneys are not working fully well, all right? So renal clearance is impaired, all right? So this will trigger fibroblast activation. So there's excess collagen deposition. So this will now lead to a thick and a hard skin, okay? So generally in the system, you are having, dead tissues. So clinical features, skin thickening, hardening and tightening, decreased mobility of joints. So joints are actually becoming fibrosed. Alright, so it could actually cause a lot of fibrosis too in internal organs like the lungs, like the heart, like the diaphragm, So risk factors, it could cause all this chronic kidney disease. It could make the patient to actually start undergoing dialysis, risk factors is what's actually causing it. So if the person has chronic kidney disease, the person has been undergoing dialysis, that's to tell you that the person's kidney is already not strong, So maybe you have been being exposed to gadolinium for a very long time, okay? Repeated episodes of exposure. Prevention is avoid using gadolinium in patients that their kidneys already have issues, all right? Then use a safer type of gadolinium known as a macrocyclic, okay? So treatment, you just have to stop using the gadolinium, right? Then supportive and all of that. All right, so we're also to talk about contrast-induced nephropathy. So contrast-induced nephropathy is just a broader term, after somebody has been exposed to contrast, especially iodinated contrast. Gadolinium is also a contrast, but this one is mostly caused by the iodine type. So pathophysiology, there's reduced renal blood flow leading to ischemia, oxidative stress, and tubular injury. Okay, so clinical features is rise in serum creatinine within 24 to 72 hours, usually asymptomatic. Severe cases may now lead to acute kidney injury. Risk factors is if the person has a chronic kidney injury before, diabetes mellitus, dehydration, high contrast volume, and repeated exposure. So prevention is adequate hydration, okay? Use the lowest possible contrast, you understand? Avoid nephrotoxic drugs around the time of contrast use. None of that, okay? So that's what we got.